Good morning, everybody. Dr. Brace here, and it's time for this week's Facial Plastics Friday. If you're watching last week, you know that we started a new series on rhinoplasty, and I spoke about nasal valve collapse because of an anatomic variant called cephalic malpositioning or parenthesis deformity. So today I'm going to continue on that topic of nasal valve collapse and talk about something called a tension nose deformity. So a tension nose deformity is when there is excess tissue right in here where the lip meets the nose. And what it does is it causes a blunting of this angle and it causes the nose to protrude up. And I'll show some pictures of this in a moment. But essentially what this is akin to is picture a tent, like a camping tent, and the center pole beside the door is too long. And it stretches the top of the tent up, and the nostrils, or the entry to the door, become very, very narrow and slit-like, which causes breathing issues. So when you take a deep breath through these small, narrowed nostrils, you're going to get collapse of your nose, you're going to get restricted airflow, you're going to have breathing troubles. The tension nose deformity also blunts this normal nasolabial angle and creates almost a flat, straight line from the lip to the nose, and so it throws off the facial harmony and the facial balance. And so for all of the residents out there, all the trainees out there, surgeons, if you ever get asked in an exam, what is the surgical maneuver used to correct a tension nose deformity, your answer is deprojection. Now, what does that mean? If you look at the face, a side view, projection is how far the nose sticks out from the plane of the face. When a nostril has when a nose has a tension nose deformity, the nostrils are stretched or pulled out, and you need to set them back so they go from long slit-like nostrils to more pear-shaped or piriform-shaped nostrils. They're relaxed, they have more of an aperture to breathe through. And so here are some photos. This is a young lady who had some cosmetic nasal concerns, but also had a tension nose deformity. And what I did here was to fix that by deprojecting her nose. We also addressed the other cosmetic concerns. So how do you deproject a nose in a tension nose deformity? Well, there are three main causes of a tension nose deformity. Number one would be that the little bone that lives right here, everyone can feel their own, that's called the nasal spine, and that can be too big. It's the pedestal that the cartilage of the septum sits on. And if that pedestal is too big and it's pushing everything up, you need to reduce it. So I use a little 2mm osteotome and I kind of shave it down and make it smaller. The second thing that can happen is that you could have excess caudal septal cartilage, and that's the septum, the bottom part of your septum down in here, just behind your columella, can be too big, can be overgrown. I've seen it many times in the OR where it's so big it's actually curling on the inside of the nose and causing a spur or causing an obstruction inside because there's too much cartilage there, it can't fit. It's stretching the skin as much as it can, but then it's rolling over on itself. So that's called the posterior septal angle down in here, and you can resect the posterior septal angle and allow the septum to sit down. You can also remove the anterior septal angle and get the nose to deproject that way. And then obviously you can combine all those things depending on what the exact anatomic issue is. And so again, here's some photos of a tension nose deformity. Notice that the angle between the lip and the nose is really just completely open and there's not much separation. Ideally, we want the angle in here to be somewhere between 90 and 120 degrees, depending on if you're a man or a woman and how tall you are. And these angles here are obviously not that. And so with a septal rhinoplasty where we address the tension nose deformity, we can restore balance to the nose and restore breathing. So I hope that's helpful. Send us your questions. I really do enjoy getting the questions throughout the day and into tomorrow. And if you have any rhinoplasty topics you want me to speak to specifically, send them our way because I plan to do this for a few more weeks and have a few more ideas, but always looking for more suggestions. Everyone have a great day. Enjoy the weekend. Bye-bye.